Kenya is a poor country located in sub-Saharan Africa with many issues. More than half of the people live below the poverty line, and there are very high amounts of inequality. Kenya is overly dependent on agriculture, which is unfortunate since it does not have access to enough water for farming and has very small amounts of arable land. Kenya also has many health issues, including high prevalence of HIV and child malnutrition. Kenya is in dire need of development, which is why we created the Kenyan Development Fund. Through the Kenyan Development Fund, we will be investing $10 billion into Kenya to help it reach its full potential.
Major health issues in Kenya include HIV and AIDS. Kenya is ranked 4th in the world for the number of people living with HIV and 7th in the world for number of deaths due to HIV. Less than half of the population reports using contraceptives, and only a little over a third of married couples report using contraceptives such as condoms. Lack of access to and use of contraceptives contributes greatly to the spread of HIV. This disease has a higher prevalence in rural areas of Kenya versus urban ones. Also, a greater proportion of women are affected in Kenya than men, yet a smaller percentage of women have been tested for HIV. Another disease prevalent in Kenya is malaria. It is currently the #1 cause of death for children there. Although the number of children who sleep with insecticide-treated bed nets has been increasing significantly within the past few years, as of 2006, only half of the child population had access to those nets. There is also high risk for contracting other infectious water and foodborne diseases such as typhoid fever and hepatitis A.
In Kenya, farming is a large part of the economy. Unfortunately, there is a lack of arable land, which leads to many issues with farming. Many small farmers in rural areas that rely on farming for their income are forced to grow their crops on very small plots of land. Forced with the issue of trying to battle poverty, they try to grow as many crops as possible, resulting in poor farming conditions and loss of land fertility. Unmet.
Kenya's urban and rural areas have unmet needs for both water and sanitation. The country faces challenges in water provision, largely caused by erratic weather patterns that cause droughts and water shortages. Kenya also has a limited renewable water supply and is classified as a water-scarce country.
Malnutrition is a widespread problem in Kenya. 1 in 3 children have stunted growth and 1 in 5 children are underweight. Also, not as many children are in school as should be. There are 1.2 million children in Kenya that are school age but not attending school, and in some areas there are huge gaps by gender. It can be very difficult for children who are malnourished to learn and attend school if they are not getting enough food to be able to function enough or to think and act properly.
Another major issue in Kenya is the fact there is not currently enough water to support all the farming practices. Very little land in Kenya is irrigated. In 2003, only 1,013 square kilometers were irrigated out of the total area of 580,367 square kilometers. The National Development Plan identifies Kenya as a water-scarce country, where the demand for water is larger than the current supply.
Part of our development plan is to improve access to healthcare in Kenya. Our solution includes reducing HIV and AIDS rates, fighting malaria, and lowering a person's susceptibility to other infectious diseases, and this will be done through the creation of health clinics in rural areas. Specifically, these health clinics will provide HIV testing for both men and women, prenatal screening for HIV, and vaccines to fight against fever and other common illnesses to Kenya. As an incentive for people to come receive those benefits, we will give out free insecticide-treated bed nets and various forms of contraceptives, including condoms and birth control. $5 billion of our budget will go towards creating health clinics.
Quality education and smart farming practices is essential to keeping the farming business in Kenya alive and prosperous. As part of a microland plan, farmers would have to attend educational classes on smart farming in order to receive loans for better machinery or to buy more land. Also, in order to make sure the farmers are able to listen to the advice without sacrificing short-term gain, the loans will cover any differences they have in income in the short term in response to growing less crops. We will give $1 billion of our budget towards farming practices, including paying for teachers, as well as supplies, and cover any of the loans we give to the farmers.
Access to safe water supplies throughout Kenya is 59%, and access to improved sanitation is 32%. We plan to partner with local water organizations to fund them as they build hand-dug wells, drilled wells, and rainwater catchments. We will also make sure our initiatives are sustainable and practical. We plan to partner with Water.org's Water Credit Program, which is a program that uses microfinance tools to connect financial institutions to communities in Kenya that lack water, sanitation, and hygiene. The financial institutions make small loans to individuals, and as the loans are repaid, the loans are redeployed to additional people in need of safe water. The average water credit loan size is $185 per loan. We plan to give 2.7 million loans, which will use $500 million of our budget.
Part of our development plan is to create a school feeding program that gives children food when they come to school. Giving children a good meal every day can help lower the prevalence of malnutrition. This also acts as an incentive to get children to attend school and has been shown to help narrow the gender gap in school statistics. $2 billion of our budget will go towards decreasing malnutrition rates and increasing education rates.
Helping Kenyan farmers receive more water for their farms would greatly improve their revenue. One such mechanism for improving access to water are individual pumps, such as moneymaker pumps provided by the program Kickstart, which have been found to increase annual household income by 100 to 200%. To date, Kickstart has provided more than 80,000 pumps to Kenyans, which has helped many families dependent on agriculturally based income. Kenyans need more opportunities like these to improve their access to sustainable water sources. $1.5 million out of our budget was given to loans and also to provide water pumps for the people.
The Kenya Development Fund can make a real difference in helping Kenya reach its full potential. By donating $500 million to water credit, we will be able to give 2.7 million Kenyans loans. The Kenya Development Fund will also be donating $1.5 billion towards agricultural loans, an additional $1 billion towards the agricultural education program accompanying the loans. Another $5 billion will be donated toward building clinics in rural Kenya that will provide both care and preventative care. Finally, there will be $2 billion donated towards a school feeding program to help increase school attendance and decrease malnutrition. The Kenya Development Fund will be able to make a better tomorrow for Kenya through its $10 billion donations to areas of great need.